All right, welcome everyone. Thank you for being here for our March Connecting the Dots meeting. We're really looking forward to connecting with all of you and hearing from all of you. It's so great to see so many people here. We know that there's a lot of great work that's happening all around the state and beyond, and so we're really looking forward to hearing about it. So the plan for today, I'll just give a quick update on what's happening on the Maine State Breastfeeding Coalition side. And my name is Kara Kaikini. My pronouns are she, her, and I'm the executive director of the Maine State Breastfeeding Coalition. And then we'll spend the rest of the meeting with you all taking a couple of minutes to share who you are, what you're working on, anything that you think would be great to share with a group of fellow lactation support professionals or parents. We might have some parents here with us as well. And the plan for that part, I will essentially call on each person to have a moment to share. And what I'll do is I will go to the participant list and I will start at the bottom this time. Often we start at the top, but we're going to start at the bottom. So we can go in that order, and you should, I will give you a heads up if your turn is coming up as well. So again, thanks for being here and welcome. We also want to thank our sponsors, our annual patron partners, for supporting the work that we do all year long. Thank you to Acceleron, Soft Corner Midwifery, Brandy Rogers, Dear Goat Dentistry, Martins Point, and Maine Health, Barbara Bush Children's Hospital, and the Let's Go program. We also want to say have a belated happy IBCLC day. If you are an IBCLC, feel free to call yourself out in the chat box or recognize someone else here who you know is an IBCLC and just thank them for being an IBCLC and for the awesome work that they do. So I want to just take a moment to recognize the amazing work that IBCLCs are doing throughout the state of Maine. And did you know, you may have seen this in an email, there are 92 IBCLCs in Maine. And we don't have a directory exactly of who all of those folks are, though we might, coming up, have an opportunity for people to add themselves to a directory. But it is sometimes a mystery. Where are all of these IBCLCs? So it'd be great to hear if you are one of those in the chat box. We, as you know, have a number of different committees that keep our work going throughout the year. I will share some updates in the rest of this document for the Advocacy Committee, the Events Committee, Workplace Committee. Communications Committee is really busy working on social media and our newsletters and our blogs. So thank you to our Communications Committee. Our Professional Development Committee is working on looking at, planning educational webinars for the rest of the year, and also on getting CEUs, which might be an exciting piece of information for all of you if you are looking for webinars that have continuing education credits. We are hoping to get those lined up as soon as possible. And Patrick Cord, would you like to share an update from the DEI committee?
Sure. Hi, everyone. I'm Petra Kaur, pronouns are they, them. I'm the president and the DEI committee chair for MSBC. DEI has actually been really busy so far this year. We're continuing on with our little book group that we have for our committee. And we also have set quite a few goals for 2024, including more advertising of our equity scholarship that we have. Starting a book group for the coalition that's related to DEI, doing more posts on social media that relate to special months. But our biggest thing is that we really want to do more outreach to communities, particularly underserved communities. So I actually have a request for you all. If you know of any community events that are open to the public, particularly in underserved communities, so think like all the events during Pride Month or parenting expos, health expos, where the public is allowed to be there and have a table. If you know of any events like that, if you could put them in the chat, or I'll put my email in the chat box and you can email those to me, that would be great. That is our biggest goal of the year, is to do more outreach. Part of that is that MSBC has joined the Maine Immigrant Rights Coalition. And we have also joined the Wabanaki Alliance Coalition as well. So,
Thank you, Petra Kaur. Okay, so you're welcome to join any of our committees. If you're interested in any of the work that we're doing, know that you can sign up to do that. And maybe Petrichor, if you want to drop the link to this document in the chat again, that would be great. So you can access these links, or specifically the volunteer form, that would be great. And if you are inspired to donate to keep our work going throughout the year, there are a few different ways that you can do that as well. So please know that we greatly appreciate any donation. And as we say, every drop counts. So any amount is really appreciated. So I want to go through and just share a few things from this document that I thought would be helpful for the coalition to know. You may already be familiar with the Best Connections Conference. That is coming up May 15th to the 17th. The first 2 days are virtual, and then the Friday is in person. And it would be great to see you there. I will be participating, giving a presentation on breastfeeding data in Maine and a little bit about New England. And I'll also be facilitating a panel about collaboration in lactation care. So looking forward to that. I think people have liked the panels in the past, and we'll have 5 fantastic panelists that will be announced in a bit. There's also a webinar coming up about the impact of doulas on maternal and child health. I know we have some doulas in the group here, and I have a little more to share on doulas coming up. We also have, like I said, this document is a shared document. It's intended for you all to add resources as well. And as I think of it, and I will sometimes drop them in here, but please feel free to add any new parent resources that you've been really enjoying, either in the chat box so we can add it, or add it directly to this document. And if you have any issues with that document, let me know too. I haven't kept up with the chat box, so I'm not sure I can do that after. And then as far as legislative updates and advocacy that we know on our end, paid leave, this is the same update we gave last month, but there is a free legal helpline that A Better Balance has. That's good to know about. And in terms of our Maine law, you can find that information on the mainefamilyleave.org website. And just a reminder that this is the year where they're working on rulemaking. They just had some listening sessions, and payroll contributions will begin January 1st. I think I saw Katie here, so maybe when Katie's turn comes up, Katie Reed, she can share a little bit more about this, and anything that you think would be helpful for everyone to know, Katie, that'd be great. Let's see, as far as doulas go, World Doula Week is March 22nd to March 28th. So that's good to know about. There's some more information on that link. And then I'm not sure if we have anyone here from the Maine Doula Coalition, but that group is still wanting to hear from doulas throughout the state. Anyone who might consider themselves a doula. Okay, don't have to be a certified doula necessarily, but anyone who considers themselves a doula, to fill out that survey and just let them know that you're out there and answer some of those questions. That would be fantastic. In terms of donor milk, really, ultimately, we need more. The milk bank needs more milk donations to come through. And so we need you to spread the word and let folks know that if they have extra milk, they can contact the Mother's Milk Bank Northeast and go through that process. Or you can help set up a milk depot like Robin did. And I see Robin's here, so maybe she'll share more about that. But we are excited to know that there are more milk depots popping up. And that is one fantastic way to get more milk donations happening so that more people who need milk can get it. In terms of events coming up, we do have an educational webinar that is coming up on April 4th. So that is good to know about. That is free. Our webinars are free still at this point. And we look forward to seeing you there. We're really excited about our Patchwork of Parenthood event coming up on June 1st in Brunswick. So save the date. We will have information released and then within the next month for how to get tickets. We're really excited about that. And we really hope that you can spread the word about our call for stories and call for storytellers. So again, this is an event where we have 6 people on stage sharing their story about parenthood. That can be a story about pregnancy, about labor, about birth. It can be about their first year of parenting. It could be about breastfeeding. It could be not about breastfeeding. It could be anything to do with this time period. And it could be foster parenting, adoption. It could be grandparents talking about what it was like having their babies when they were younger. Anything like that is really welcome. And we really want to diversify our field of storytellers as well. So And that can be, you know, from race and ethnicity to geographical location to gender, age, anything. We want it to be really quite a variety of stories and storytellers that we're hearing from that night. And so the pitch is done either through filling out a form and sending in a 250-word pitch, or emailing in a 2-minute audio recording. That's just the main idea of the story. And then there's lots of support on developing the story between when we select them at the end of March until the event on June 1st. We'll be giving lots of support, including help from a writer. So really excited about that. Feel free to ask any questions about that if you have them. Workplace support, we've been really busy with our workplace support activities. You may have heard about our toolkit, Returning to Work, Resources for Pumping and the Breastfeeding, Chest Feeding Parent. We have had 113 downloads so far, and we know there are a lot more people out there who could use this. So please continue to spread the word about that toolkit. We are working with Let's Go and a lot of folks on this call who are from the Maine Prevention Network, HEAL coordinators. Thank you for your support on these next steps, which is developing an employer toolkit and also developing a workplace recognition program. We are collecting, we really want to hear from parents about their experiences at work. We've received 13 responses to this survey so far. We want to hear lots more. So we want to hear from people what their experience has been like at work. And your experience, if you have been someone who has pumped at work either recently or you currently are, we'd love to hear from you. We're also really excited to be in the process of planning a video that will be developed over these next few months that will highlight a couple of workplaces, and we'll have some pretty important speakers on this video sharing why it's so important for workplaces to be supporting their employees. So stay tuned for that. But on that note, if you know of a small business or work site in the Mid-Coast or Southern Maine area in particular, our filmmaker can only travel so far, unfortunately, or we can only pay her to travel so far. If you know of any small businesses or workplaces in this general area who should be celebrated, well, really, if you know of any workplaces in the state of Maine who should be celebrated for how they're supporting their employees, let us know, because we definitely want to be recognizing them at some point. But in terms of this video, we need some folks, a place that's local and on the smaller side to demonstrate how they can support families. I didn't have any job opportunities to list, but if you know of any, please share. And then there's some other news here. The Maine CDC is doing community forums. So this is really good to know about. If you didn't already know about this, please be sure that you have this information and either join yourself or families that you are working with, encourage them to join one of these input forums to share what they think the priorities should be going forward within the maternal child health department. There's a webinar coming up, a couple webinars that are good to know about. If you are in a hospital in Maine, know that there is a CHAMPS national program out there that is looking for hospitals to apply. I'm happy to talk more about this, but I want to make sure you all have time too, so I'm moving quickly. I've shared before about the healthcare training for Maine program. That's also good to know about. That funding is ending soon, and it can help anyone receive healthcare training, including lactation counselor training. So know about that. Plus we have our equity and lactation scholarship opportunity that is available as well if you're looking for lactation specific training. We have our educational webinars coming up. Our next meeting will be May 9th, and that is our annual meeting. So on that note, enough from me. I really want to make sure everyone here has a chance to share more from your end. So if I go back up to the top here, if you can share your name and your organization, your town or city when it comes your turn to introduce, and anything that you want to share. It can be something that's happening in your workplace or something you're working on, any questions you have, anything you want input from everyone else, then now is your chance to do that. So let me stop sharing my screen. And again, this is a really great time for folks to have cameras on if possible. And I will start at the bottom, and Connie Montpetit is at the bottom, I think, because she doesn't have a microphone listed. So Connie, I don't know if you're able to speak or not. Maybe you can introduce yourself or share anything in the chat box that you'd like if you haven't yet. I have some catching up to do in the chat box. All right, next up is Zakia. Zakia, are you able to share? Not seeing. Let's see. Okay, maybe we'll come back. Oh,
Hey, sorry, I was away from my computer. Can you repeat the question again? Sorry.
no problem. So this is your opportunity to introduce yourself and share where you're calling in from and anything that you want to share with this coalition about breastfeeding, any questions you have or anything that you are, anything you're working on.
Absolutely. Thank you so much. My name is Zakia Sheikh. I'm a community health worker at New Mainer's Public Health Initiative. We're a nonprofit located in Lewiston, serving a variety of different communities in the greater BIPOC community of Androscoggin County. Currently, we have our maternal health program up and running, which is really exciting because we're really focusing on sort of addressing some of those disparities that we see when it comes to maternal health for BIPOC women. And we're kind of looking to expand. So currently we have English language supports, Somali language supports, French language supports. So just sort of trying to expand and see what connections that we can make in the maternal health space for things like breastfeeding, lactation counseling, perinatal health classes. So if there's any information that you have, resources that you can share with me, I would love to connect and see where we can go from there. Thank you.
Excellent. Thank you so much, Zakia. Glad you're here. Thank you. Okay, next we have, I'm not sure if this is the name or, so Trenadoa. Is Trenadoa available? We can come, oh,
Hello, my name's Angelica and I am from Tehama County, WIC.
okay, welcome. And can you say the county again? And is that in Maine or is that not in Maine?
No, it's in California.
Okay, awesome. Thank you for being here.
Thank
Do you have
you.
any questions or anything that you want to share with Maine?
No, not really.
Okay, glad you're here. Thanks for making it.
Thank you.
All right, next up is Tessa.
My name is Tessa Roshdo. I am a new public health nurse in Aroostook County. I had previously been a labor and delivery nurse for about 3 years, so I worked a lot with breastfeeding moms, and I'm currently taking the lactation counselor course to get certified right now. And I also worked pretty closely with I believe she's the only IBCLC in Aroostook County at Holton Regional Hospital.
Okay, excellent. Thanks for being here. Shauna.
Hello, I'm Shauna Goulet. I'm a labor and delivery nurse at Eastern Maine, and I'm a perinatal outreach educator traveling all over the state. I'm currently in Mars Hill, and we've got still lovely snow going on here. I'm just going to put a plug in for the A1 section chair. And so we have our A1 Spring Convention in Freeport coming up April 25th. We have a couple of great speakers related to breastfeeding and chest feeding. We have Dr. Katrina, I just lost her last name just because I wanted to, coming from California, whose family lives in the Bowdoin area, that's going to be talking on mastitis and what we can do to help with that. And then Paula Norcott, our amazing Paula Norcott, is going to be doing some discussion on the lactation support and how we can do it in a non-intrusive way to make patients more comfortable and accepting of our help with that in the hospital settings.
Excellent. Thanks, Shauna. Are you driving, by the way?
Oh, yeah. Oh
Okay.
yeah, it's all
Okay.
good. It's all good.
Okay. Well, thanks for joining and sharing. Sarah Hand, you're up next.
Hi. Shauna is cracking me up driving while she's doing this. But anyway, so I'm Sarah. I'm a public health nurse here in Bangor. And I'm happy to say that tomorrow is our 3-month mark of starting our breastfeeding support group called Milk and Cookies. And it's been going pretty strong and pretty regular. We're having 7 or 8 moms and babies every week and going through lots of cookies. And it's a good time. It's a good time. So I'm looking forward to tomorrow to see who shows up. You never know, but I guess that's all I have for an update.
That's great. Sarah, can you share again where and when that happens and maybe drop that in the chat if you haven't already?
Oh, I haven't, but I can try to do that. I'm not tech savvy, but I'll try it. So it's every Friday, Bangor Public Library, 3rd floor, which is the children's department, noon to 1. And a little secret, we actually have the room until 2, but I don't announce that because it always goes until about 2. Like I have to kick people out at the end. But if I told them 2, then they'd stay till 3, you know. So anyway, it's a lot of fun, and I will work on dropping that in the chat.
Awesome. Thank you, Sarah, so much. And Sandy Fortin.
Hey, everybody. Healthy Eating Active Living Coordinator in Hancock and Washington County. Work for Healthy Acadia. And I'm really excited. Just got funding with my collaborators, Prosper, to create a community lactation station tent. We're going out on the road, hopefully starting May 1st. Have some community baby showers, a lobster festival, Indian Point we're going out to, so covering all of Hancock and Washington County, and looking for additional items that we can hand out as free things for our guests that show up at our lactation tent. So if any of you have some great recommendations, feel free to send me a message. Thank you.
Thanks, Sandy. That's exciting. Ruth Prue.
Hi there. I apologize. I'm also driving, but my name is Ruth Prue. I'm a public health nurse with the Maine CDC down in out of the Portland office, Cumberland and York counties. And yeah, seeing a lot of breastfeeding moms right now.
Excellent. Thanks, Ruth. Okay, Robin Snyder Drummond.
Hello, I'm Robin Snyder Drummond. I'm an IBCLC in Ellsworth, which is Hancock County. And I do office consultations at Anchored Women's Health, which is the private practice of Kristen Hayward, a CNM. So we have a milk depot now, and we've had 2 little open houses. One woman came and told me the wonderful story of how important it was for her baby to get donor human milk when she was in the intensive care unit after birth. So that I'm going to write that in my blog. You can read that at birthready.com. I haven't posted it yet, but I sent out a lot of information to health care organizations and providers, but I really need to connect with moms. So I've already sent a chat message to Sarah Hand, but I really would love to be able to meet any moms at breastfeeding groups and tell them about this opportunity to donate, and then they can come to Ellsworth, which is hopefully convenient for people in the Hancock or even maybe Knox County or something. So my name is Robin Snyder Drummond, and I'm in the chat box at robin@birthready.com. Thank you.
Excellent. Thanks, Robin. Riley.
Riley answered in the chat. She says, apologies, things are loud here right now, so I'll type my intro in the chat. Riley Blanchette, she, her, Social Services Director, Maine Families Program Manager, Prevention Council Director, Franklin County Children's Task Force. We have many events coming up held by Franklin County Children's Task Force. I've compiled a Google Drive folder of photos of our events, and we are hiring for Maine Families home visitors in Franklin County. As a Maine Families home visitor, you would gain the opportunity to become a CLC. If you would like to table at our upcoming community baby shower on June 15th, please email her at riley@fcctf.org. April is Child Abuse Prevention Month, and she gives a link to the Google Drive.
Excellent. Thanks for being here, Riley, and for sharing those opportunities. Awesome. Renee, you are next.
Hi, friends. My name is Renee Shalou. I'm a public health nurse with the Maine CDC, and I work in Aroostook County, primarily covering the Presque Isle area, doing in-home support, lactation counseling for new moms. Mostly we get referrals from our local hospitals. So yeah, I'm just here to listen and learn. I'm happy to be here.
Excellent. Thanks for being here. I'm so glad to see Aroostook County represented here today. All right, Michelle Mangin.
I work for the City of Portland Public Health, Maternal Child Health. We are now receiving grant referrals from both Westbrook and South Portland, in addition to Portland, for the Cradle Me, which is new for us. And other than that, that's about it.
Okay, thank you, Michelle. And Michelle Segovius.
Hey everyone, Michelle Segovius from the Portland Opportunity Alliance WIC program. Don't think I have any updates right now, and I see that Lillian from our program is also here online, so if she has any updates, I'm sure she'll share in a little bit. Good to see everyone.
Great, thanks for being here. All right, Melinda Corey.
Hi everyone, I'm Melinda Corey. I'm the outreach specialist over at Help Me Grow Maine. We are a resource that helps families who have children birth to 8, as well as pregnant caregivers, to get connected with resources and supports they might need in their communities. We're a free statewide service for all families, regardless of income or citizenship status. And a couple of quick updates. It's been a little bit since I was here, so I just wanted to mention that we have this past fall been able to hire a full-time cultural broker for our team. About 20% of our referrals are non-English speaking families, primarily New Mainers. And so he is particularly available in his role to support families that might be struggling. He has a real passion for helping families who maybe struggling to understand or deal with the medical system here, and has actually been able to intervene in some situations where children were potentially at risk of being removed because parents were not understanding doctors' orders around feeding and things like that. So very helpful to have that resource. We also are looking this year to get information about Help Me Grow into birthing units. So if you are someone who has access to birthing parents, or to like folders or packets that go home with birthing parents, I'd love to meet with you. We want to make sure that every family in Maine knows that we are an option for them. So I think that's it for now. Thank you.
Excellent. Thank you so much, Melinda. And I don't know if you've already shared in the chat box a little bit more about Help Me Grow, like your website would be great. I am curious how many people here are familiar with Help Me Grow. I'm hoping it's a large number, but it's really good to know. So if you can nod your head or your hand or do a thumbs up on your thing. So I'm seeing Lori's shaking her head no, and Brittany's no in Massachusetts, New Hampshire. I'm seeing some thumbs up, some head nods. If you can share a little bit more, Melinda, for folks in the chat box anyway, like a website and if anyone in your contact info. So if anyone isn't familiar and wants to hear more, then that would be Melinda's the person to talk to. I think it's a program that I would love to continue. I'm so glad you're here, Melinda, because it's every once in a while I'm like, oh yeah, Help Me Grow. Like we need to connect a little bit more.
It's good to keep the word out. We've finished our first full year of service. We served just over 700 children from every county in the state. One of the big needs that we're noticing, that we're trying to wrap our heads around and figure out a creative way to address in this year, is diaper needs. So not breastfeeding or chest feeding, but very highly related to needs of those new parents. We just are in awe of the level of need, honestly, the more community partners we talk with. And it's really frustrating that Maine does not have a better systematic way to address diaper need. And you know, it impacts economics. Families cannot go back to work and put their babies in childcare if they don't have the money to pay for diapers for childcare providers to put on their babies. So we're hoping to find some creative ways to think about that this year. So also very interested if anyone out there either, you know, is also thinking about that or has ideas, would love to just brainstorm with you. It's a real area of unmet need that we're bumping up against pretty much every week. So, and I'd be happy to come back at some point and do another presentation, Kara, if I know the next meeting is the annual meeting, but at some point, if a little 10-minute refresher would be helpful for new folks, I can do that as well.
That'd be great. Yeah. And our newsletter too. If there's anything, if you send me something I can put in a newsletter, I'm happy to do that.
Oh, great. I will do that.
I also just came across something that Pampers does. They help create something called a diaper stash. I don't know if anyone has seen this or done it, but it looks like it's just a way for people to crowdsource diapers, or it's kind of like people can sign up to donate diapers to that family. So just put that in the chat if that's helpful at all.
Yeah, I will check that out. Thank you.
Thank you, Melinda.
Another thing, Melinda, where I'm driving, Kara, can you send me her contact information? Because we're doing a diaper drive as part of our conference, and I haven't chosen yet who we're donating diapers to. So just let me know.
That's great, Shauna. Thank you. We will have someone reviewing the recording of this and typing up notes and of who everyone is and everything everyone's shared. So that will be, I usually linked to that Google Doc that I've shared. And I did see someone say, I know Google is not accessible to everyone at work, so I apologize for that. Petrichor will make that into a PDF and send, if you let them know that you would like a PDF of the notes, then that can be sent to you. Plus in the next newsletter, I can be sure that a PDF is attached as well as the Google Doc. So thank you for that reminder. Okay, moving along, I believe Mary Block is next. And I know that she added in the chat box that they have 2 in-person breastfeeding and chest feeding support groups at Maine General in Augusta. And that information is there the 2nd Tuesday of each month, 4th Thursday of each month. The info is on the Maine Gen website, and the scale is also available there to do weight checks. And on that note, I know that the Maine Medical Center breastfeeding group is being facilitated by someone by the name of Brooke now, and that is happening on Tuesdays at 9:30 in the morning in Falmouth. And then, yeah, any other groups you know of, feel free to drop that in the chat. Let's see, Mary Ann McDormand, you are next.
Afternoon, everyone. I'm Marian, and I work for the City of Portland Maternal Child Health Home Visiting for maternal child health clients, prenatal clients, parents, babies, for health assessments and breastfeeding support, chest feeding support, bottle feeding, any type of support. Michelle is on our team. She's an IBCLC, and she mentioned that our services have expanded from Portland proper to Westbrook and South Portland. So we're working in congregation with state public health nursing to serve the maternal child health population. And right now, our team has 3 CLCs and 1 IBCLC. So we're looking forward to, again, serving more folks. We're also joining Mercy Birthplace Nurses at a transitional home for maternal child health asylum seeking clients who need, just a place to, who are unhoused and, to get their skills and have a safe place to be with their children and be supported through their pregnancy to do. We're doing educational sessions and kind of a hybrid centering type of approach, baby clinic. Next week's topic is lactation, because a lot of the women do breastfeed, but they're supplementing too. And it kind of, again, just trying to adjust to doing both of those things. And and again, I guess that's a big thing with this, the asylum seeking population. Many of the women choose to both breast and bottle feed. But we want to support them in the best way to do that. But it does get confusing sometimes as the babies sometimes don't want the bottle as much, or they don't want the breast as much. And there's just a lot of confusion. So that's something we're running into, and we're trying to kind of give a message about how to best support that, and also make sure babies are well fed and moms get to also support each other in this group setting. So thank you.
That's great, Marianne. Thank you. Is that the Francis? Is it?
Yes, it's the Francis Ward. Sorry. Yes.
That In Her Presence runs that.
In Her Presence runs that. Yes, for and they have a new
great.
program coordinator, Jessica Sobey. So we've done these classes weekly for about 5 weeks now, and covering topics like safe sleep, car seat safety, that just, constant reminders, things we do on our in-home visits as well with folks most times, because it is a big learning curve too, coming to a new country that has all these regulations and safety measures, and not all of it's very intuitive. And but kind of doing it in the group setting where everyone can hear the same message, and we have interpreters and chows come in too. So it's and we're hoping maybe to opening up to some other community people too, other than just the guests of the house. So
Great.
we'll go from there. Every week's a new week though. So
That's great,
yes,
Marianne. Are
thanks.
you able to put your name in the chat, your email address in the chat box in case anyone has any
Yeah, I
questions?
can do that. Yeah, that's great. Okay.
Thank you. All right, Maddie, you are up next.
Hello, I am Maddie. I'm also a maternal child public health nurse with Marion and Michelle. We're all in the same room. It's kind of funny. I just got my CLC like 2 weeks ago, so that's super exciting. And yeah, I'm new to this work, so I'm happy to be here.
Awesome, congrats. Glad you're here. Lisa Stout.
Hi, I'm a family practice physician in Waldoboro. I used to do a lot of lactation work up in Dover Foxcroft when I was up there. So just looking to get new patients.
Is there a name of your practice that you're earning
Oh,
info?
I'm just through Lincoln Health, like the Lincoln Health Hospital family practice.
All right, thanks, Lisa. And Lisa Campbell.
Hi, I'm Lisa Campbell. I'm the director of obstetrics at Stevensboro Hospital Birthplace. I'm also a CLC, been one for 8 or 9 years now. I guess I don't really have anything to share besides if anybody has in-person classes for CLC, that would be great. All my staff don't really like the online module, so they really would like an in-person class. So we used to have all of our staff members be CLCs, and now we're down to like, I think it's like 8 of us left, 20 something. So yeah, so I wouldn't mind an in-person class if anybody has any resources on an in-person class.
Can you say where you're from?
Stevens Memorial Hospital, Norway, Maine.
Have you connected with Paula Norcott at all?
Don't think so.
Okay, I can send you her contact
I
info.
I did sign up for the breastfeeding champs thing too.
Oh, great.
I figured as many resources as we can get.
Yes.
But that's the input from my staff is they really want an in-person class.
Yeah, yeah. And I know Paula's really wanted, she does do some trainings. Some of you may have received some trainings from Paula. And I know that she's wanting to do more. So like larger trainings as well.
And that would be great. We can host here too. I've already got the permission. So
okay, I will definitely connect you.
Thank you.
Thanks, Lisa. Okay, let's see here. Lillian. Lillian, are you available to unmute and introduce yourself?
Yes, I am available. Do you hear me?
Yes.
Okay. Good afternoon, everybody. My name is Lillian Vitali, and I work for the Opportunity Alliance Week program. And currently I work at the hospital, Maine Medical Center. We are implementing implementing our community innovation outreach project that we just started recently. And we are seeing patients in the hospital at Maine Medical Center. So one part of this work that I love is we get to meet parents in their admission bed and do their appointments after delivery. So it's really so nice to see them when they're relaxed and like breastfeeding their babies and having that conversation with them. And we are stocking some electric breast pumps through the WIC program so that when a parent or a mom is discharged from the hospital and could not go through the WIC office to pick a breast pump, we'll just issue for them a breast pump from the hospital to go with home with all the accessory parts, that's nursing bras, and we have the milk storage bags and some of the breastfeeding items that they may need. And we have 2 nutrition counselors who are here with me. So they only work, one works 5 days a week and the other one works only 3 days a week. So we have limited coverage on Thursday and Fridays, but Monday to Wednesday, we have full coverage. So thank you very much.
Yes, thank you, Lillian. It's really exciting to hear about that option and that program, and keep coming to give us updates to let us know how it's going.
Thank you.
Thank you. Okay, Lori, you're up next.
Hello, everyone. My name is Lori Crater from Louisiana WIC. So I'm the designated breastfeeding expert for the state. So I also work with the Pacify app. So I'm a LC with the app that runs nationwide. We are doing virtual breastfeeding classes and prenatal classes. They've expanded quite a bit. So now we're dividing them up into 2 different classes, prenatal and breastfeeding. And then now we're getting started for in-person classes as well. We do these also in English and Spanish. We also, the state has an emergency call out right now for breast milk for the milk bank. So we're working a lot to try to get more donations to the bank. And then we've also kind of partnered with an organization here called the Family Tree, and we've introduced baby nooks. So it's like a, if you can think of like how a box of like people would donate library books and people just come and take the books they want, kind of, and just like that, like in a little box outside somewhere. Well, we now started that where it's a diaper nook. And so people come just, we have them like put in different places. Like we have one here at this clinic, and it's just a box, and it's diapers and pacifiers and just other baby supplies all in there. And people just come and take what they need. And then others donate things. And then like there's organizations in the city that will do it as a fundraiser where people come and donate to them, and then they come and donate to the Nook. So, yep, I think that's about it going on right now. Thank you.
Thank you, Lori. That's a great idea. Thanks for sharing that, and thanks for joining from Louisiana.
Thank you.
Laura.
Hi. I'm Laura Coos, and I have a lot of irons in the fire. I'm one of the instructors for Maine Medical Center's community lactation classes, which I do once a month. I also deliver the lactation lecture to medical students who are in OB clerkship at Maine Med in the Tufts program. And let's see what else. I have a private lactation practice in Biddeford, which is in York County. I do home visits and telehealth. And in that practice, I do routine lactation care, but I also specialize in complex feeding issues, breastfeeding problems, lactation problems. I'm a massage therapist in addition to an IBCLC, and I'm also retired from midwifery practice. And I'm completing my FNP this spring. and all of those really are lactation focused for me. So I do a lot of myofunctional work with the babies that I take care of with lactation problems. And part of my goal with my FNP is expanding to more medically complex management of my lactation clients. So that's what I do now. And yeah, and I also have a little professional development that I've been doing with this group, which when I have a little more time in my plate, I will be devoting more of that to. So I'm happy to see everyone.
Thank you, Laura. And I don't know if you have already put your contact info in the chat, but that might be nice for some folks to have. Great. Catherine. Is Catherine Dewar available?
Hi there. Can you hear
Hi.
me okay? I am a CPM and IBCLC up in Kingfield, and I have a private practice, Moonstone Sunrise. I'm also the co-chair of MACPM, newly co-chair, so still learning the ropes there. And I'm mostly listening today while I filter and canned syrup. So but I'm loving all these resources, and I'm gonna definitely have to check that chat box out and look at the email after this with the newsletter. So thanks for everything you do.
Thank you. Thanks for being here. Happy canning.
Thank you.
Kate Crothers.
Hi, I'm Kate Crothers. I'm with the Our Moms Grant with the Rural Maternal Obstetrical Management Strategies. And I love hearing from everyone in the rural voices with lactation. And so it's so exciting being part of this meeting and hearing about these great resources. Thank you.
Thank you, Kate. Yeah, and if there's anything you need from us or anything that we can do to support the Our Moms program, let us know, and feel free to drop any info in the chat too.
Great, thank you.
All right, Karen?
I think that's me. Hi, I'm Karen Skuris. I'm IBCLC living up in Madawaska. And it's been so nice to reconnect with you, Kara.
No. Yeah, we realized that we both used to work together or teach together in California many years ago. So I recognized her name, and it's been fun to see you here in Maine. Thanks for being here. All right, Julia.
Hi, I'm Julia Halley. I'm from Healthy Community Coalition of Greater Franklin County. I'm the HEAL, so Healthy Eating Active Living Coordinator, and also the SNAP Ed Coordinator and Educator. So I'm just here. We do a lot of breastfeeding promotions, so I'm just here to learn a lot more and see what other resources and such there are out there.
Awesome. Thanks for being here. Great. And I'm noticing the time. We have about 9 minutes until 1. And if we can stay a few minutes over, or I know I can, but you might not be able to. So if you haven't had a chance to introduce and you know you need to leave by 1 o'clock, maybe raise your hand if you can find that icon, or drop something in the chat and let me know that you need to go next, and we can go a little out of order if necessary. And maybe that's Jen. Well, actually, yeah, Jen Vijay, would you like to go next?
Sure, I have my participant is here waiting for me, but just a small update for York County Community Action Week program. We did hire a new RD, and so she's been on staff for about a month, and she's just started recently seeing participants, and she's currently a breastfeeding mom herself. So she started our breastfeeding curriculum. So she has done her level 1, and then but so she's all set there. So that's our biggest update is our new participant, our new staff member.
All right, it's exciting. It's always great to have new staff members on board. Awesome. Okay, Erica Freeman, I see you need to leave at 1.
Hi, I'm Erica Freeman. So I'm the breastfeeding coordinator at the Bangor WIC office. We don't really have too many updates. I am excited. We do have 3 in-person breastfeeding support groups within Penobscot and Piscataquis County now. Sarah's being one of them, and she already talked about that. I think Cynthia's on here as well. She might have a little bit more input of the other 2 groups that I know that she is in as well. But yeah, that's really all.
Great, thanks. Well, Cynthia, would you like to go next?
I don't know how I beat Erica, but so my name is Cynthia Grass. I'm the Public Health Nursing Supervisor for the Maine CDC for Penobscot and Piscataquis counties. We are free service. We are offered to anyone across the state of Maine. We're doing a lot of great things. And like Erica mentioned, we're starting to partner with our community resources with WIC and Maine Families and a hospital over in Mayo. And we're starting support groups. And we're finding that there's a huge need for this, and we're doing them in person. And we started one last week in Millinocket, and the one in Dover has been going since December. So, no, excuse me, January. Sorry about that. And we're really excited to be doing them and really excited to be working with our community partners. It really brings everybody together and shows how much support there is out there that people just aren't aware of. So I also just wanted to pitch right now. They're filling up quickly, but we are looking for PHNs across the state of Maine. And when you come on board, you will send you for your CLC certification. And also we're sending people to get car seat certified as well. So those are all free services to anybody across the state that if you know of anybody, it's Cradle Me is where to put the referrals in. And our referrals are kind of going up every day. So that's super exciting. So the word's getting out there. Thank you so much.
Thanks, Cynthia.
Yeah.
Okay, we'll go Katie Reed, then Connie, then Ellie, and then we'll come back to the list unless you have your hand up as well. So Katie.
Hi, everyone. I'm Katie Reed. I work at the Maine Women's Lobby. I use she, her pronouns. And I don't have a large update, but I did just want to share with folks like Kara had mentioned before. If you are interested in paid family medical leave in the law that has passed, benefits will not be available until 2026, but contributions will start just next year. So if you are interested in being engaged in trying to lift up that program and keep promoting it, or if you want more information or your members or clients need more information, please let me know. And we would love to partner on any presentations or education.
Great. Thanks, Katie. Yeah, if you can put your contact info in the chat, and then also the link that you shared yesterday with the updated information about paid leave. I meant to include that in our document, but I didn't. It looks like I didn't. So anything that you can share in that chat would be great. Thanks, Katie. Connie.
Hi, I'm Connie Montpetit from ACAP up in northern Maine. And I've been CLC for 10 years, over 10 years now. Trying to think here. 2013. So yeah, going on 11 years. And I'm the peer counselor here at ACAP for WIC. But I do talk to anybody who wants to talk to me. And if I can't handle it, I send it to our IBCLC.
Awesome. Thanks, Connie. Thanks for doing what you do. Ellie.
Hi, everyone. Thank you so much for giving me the chance to speak to you all this afternoon. My name's Ellie Mulpeter. I'm the program coordinator for InFact USA. We're a nonprofit organization based out of Massachusetts, and we focus on protecting, promoting, and supporting breastfeeding by providing education about the International Code of Marketing of Breast Milk Substitutes, which was issued by the WHO in 1981. And I just wanted to pop on here quickly. Kara, thank you so much for giving me a chance. I know I only have a minute or two just to talk about a research study that we're doing currently, and I'll drop all the information in the chat. But we are doing a really exciting, fun, engaging research project with members in the United States and Australia, Canada, and the UK. And we are basically doing a scavenger hunt to identify actual code violations for the marketing of breast milk substitutes. So it's a really fun app. I can send over all the instructions. Participants complete an informed consent and then have a scavenger hunt list to be able to participate and identify some really well-known, some not so well-known violations of the Code of Marketing. And our hope is to be able to bring awareness to these 4 countries because we don't currently have any legislation in place to protect specifically the digital marketing practices that are predatory of formula companies. And just on a personal note, I had to share it. I am based in Massachusetts, but my mother is from Millinocket and I grew up going there. I love Maine so much. I was just there for a whole week and it just means so much to me that you all are doing this incredible work here. And I will share some more information in the chat as well. Thank you.
Very cool. And Cynthia, I don't know if you knew that when you started to write that info about the Mom Connection Millinocket, but that's pretty cool. Yay.
That
All
is
right, thanks,
awesome.
Ellie. Yeah, Ellie, share whatever you can with us in the chat, and then anything you want me to email out in a newsletter, I'm happy to do that as well. That sounds really interesting. Thanks for doing
Thank you.
the
Yeah,
work.
it's been fun. It's been great. Thank you very much.
Okay, who else? I know we're nearing 1 o'clock, so thanks all for hanging in there. I'll start back at the bottom, but feel free to raise your hand if you need to go. Joanna Cowett.
Hello, I'm Jonah Cowett. I am a DEI program consultant, and I work in HR at LL Bean. And I'm interested in being in this group so that I can think more creatively about what to include in our corporate learning, development, and how to support leaders in appropriately supporting breastfeeding parents returning to work, which we're doing a lot already, but I'm interested in staying on top of it. Thank you.
Thanks so much for being here and for working with us. We're excited to work more with you. Thanks. All right, Ivory.
Good afternoon, everyone. My name is Ivory Mills. I work for Maine Children's Trust that, although stationed in Augusta, we have a statewide reach through our support of the prevention councils and the Maine Families Home Visiting Program. We are celebrating 30 years worth of service and have been doing some events at the Governor Hills Mansion, also going to be at the Hall of Flags, just to help make sure that people are aware of what's happening with families and how our desire to continue to help support everyone as best we can. So thank you so much for letting me be here.
Yeah, always good to see you, Ivory. Thanks for being here. Gia. Oh,
Hi, I'm Gia Bartolomeo, the Executive Director of the Community Doulas. We used to be Community Doula Birth Program, not anymore. So our updates are for 2024, we're actively recruiting doulas throughout the entire state. Either people who want to be doulas to train them or people who are already doulas to partner with us. We primarily serve resettled communities and communities who can't afford doulas. We work primarily for free. We're 100% volunteer. We cover doula expenses, but that's it. The other thing I want everybody to know is we have materials like this that explain, I don't know if you can see it, what a doula is. It explains what a doula is. We have it in 13 languages and you can go on our website to order them if you want them in your office.
Great. Thanks, Gia. Can you put that website in the chat if you haven't already? Thank you. Thanks for being here. Emily, I see you're here. I'm really glad to see you're here. I hope you have a minute to introduce yourself. Emily Watson.
Hi, yeah, sorry, it took me a second to find my mute button. My name's Emily Watson. I use she, her pronouns. I'm the perinatal outreach coordinator for the southern region of Maine. I'm new to this role. I'm super excited. My role kind of in this realm is just to be a connector, a liaison, a support, whatever people in the breastfeeding realm need, either in like bolstering their inpatient services or just kind of being connected to whatever services they need. So you guys may see me in various different realms. Always feel free to reach out to me if you feel like you just need connections with somebody. And I'm really excited to hear about all the amazing work that is being done. Like I said, this is a new realm for me. And so I'm just really so happy to see all of the brilliant people that are working on all these great things. And I was thinking kind of throughout this meeting about the diaper shortage that, oh, I'm gonna forget who brought that up. I think she's logged off now, but I am definitely somebody who kind of throws ideas out, irregardless of how complicated or impossible they may be, and then just kind of tackles it from there to see if it's feasible. So I'll just throw like a couple of ideas out if anybody here in this space finds them useful, great. If not, totally fine. But I'm thinking about, because I also work clinically as a labor and delivery nurse, and I'm thinking about like all of the information that we have in their discharge paperwork to go home. And what if there was like a little fund set up for people to donate, you know, $2, $10, $50, however many dollars to some fund that was created for diaper services throughout the state. That was one kind of thought that I had for financial support. And then for more like the diaper drive aspect, Shauna, that's awesome that the A1 conference is doing that. And I'm also thinking from like a personal standpoint, I know having had 2 kids in diapers, I would always end up with these like massive packs of diapers that they grew out of. And I was like, what the heck am I going to do with all these diapers, and not having a great space to put those. So I think of places like, you know, Goodwill, Salvation Army, any of the, like consignment, like kids consignment stores that exist that might be interested in having like a diaper drop box, obviously for diapers that are boxed or sealed and could be passed on. So anyway, I just throw those ideas out. Maybe they're useless, but if they take traction with anybody, then great.
Awesome. Thank you, Emily. Glad you're here. Deb.
Hi, I'm Deb. I'm work out of Bangor Public Health doing healthy eating and active living. And Cindy already talked about our Millinocket group that I sort of pulled people together, and really they did all the work. And it's up and running. They've had 1 meeting so far, and helping with the workplace stuff. And I love hearing everyone's updates. So I'm glad to be here.
Casey Marcotte.
Good morning, Casey Marcotte with Southern Maine Healthcare, covering York County for the Healthy Eating Active Living work. I do have one thing. I mean, we have a million things that we're working on, but one thing in particular, because one was this morning, but we've been supporting the Mother's Circle support group that Southern Maine Healthcare offers, and it is very poorly participated. Nobody showed up this morning, which nobody's showed up since January 7th was the last one. So just looking for tips and ideas on what makes a successful group. And I feel like we can all put that creative hat on and like answer that question, but we're not having success. And so, you know, we've advertised on every avenue and platform and physician's office and flyers and, you know, things like that. But like because of our role, like we're the supporters, we're not the doers. And so if the doers aren't getting the support to continue to run the meeting, then we won't have these circles. And we've already seen it go from weekly to bi-weekly. And of course, if nobody's showing up, then the, you know, higher ups are saying, why are we sending you there? So we don't want to see it fizzle. We're determined to keep it happening. I personally think location is one of our biggest barriers because there's no parking. It's not in the hospital, it's in a building that's off to the side. So if you're not familiar with what the building is, like you just drive around looking for it. And so, yeah, there's definitely some barriers, but just looking for tips so that we can help keep this going because it's the only one we've been able to identify in York County too.
Thank you, Casey. I think you're not alone in that struggle to get those groups filled. Really great to hear about the groups that are going well. So if anyone has any thoughts, I would say either drop them in the chat box while we go through these last introductions or send Casey a direct message. I think that would be fantastic. Thanks, Casey, for being here and sharing that. Selena?
Hi, it's Kalina. I'm Kalina Keating. I'm a registered nurse. My background is in neonatal ICU. and where I actually can still work at Maine Medical Center in the NICU and the continuing care nursery. I'm also sitting for my IBCLC next month, which is really exciting. Lots of studying to do still. I also own a private practice called the Mama Coach. It's part of a large network internationally, but I own the branch here in Maine, and I do very well-rounded holistic support for new families, whether that's sleep, feeding, just general newborn care. But I really love working with babies that are struggling with feeding, especially when looking at breastfeeding, bottle feeding combination. I also teach a CPR class at Root to Rise once a month, and I can also do it private in home. So if you know any families that are kind of in that starting solids age or are looking for an in-person CPR class, that's once a month on Wednesdays at Root to Rise, which has been really great and pretty consistent group showing up for that. And I'm just looking to grow. I'm in the Biddeford area, but I can serve the whole state virtually and about an hour radius from Biddeford in home, one-on-one. So it's great to be here. I'm looking forward to for future meetings.
Great, thanks, Kalina. Yeah, if you can put your contact info in the chat, that would be great.
Definitely.
Caitlin Wright.
Hi, everybody. I am Caitlin, public health nurse with the Maine CDC. I cover Oxford and Franklin counties and Androscoggin as well. I don't think I have any updates right now. Thank you.
All right, thanks, Caitlin. Glad you're here. Brittany.
Hi, everyone. My name is Brittany. I am sort of coming in as a representative of all different things, lots of different passion points. So the first thing that I guess we'll introduce is Zip Milk. So I'm the National Director of Zip Milk, which is a project of the Massachusetts Breastfeeding Coalition. And Zip Milk is a support website, and it is for families to find support for free within their immediate area, if not a little bit further, because we have virtual support options. And so this is also for providers and is free for them, where they can list their services, whether they are an IBCLC, a support group within La Leche League, a medical provider that also works with lactation, and things like that. There are 6 different categories within. So I'm going to put it in the chat if you ever want to look. Maine has joined Zip Milk, and we have it set up to get started. And so the way that a process works for providers is they would put their listing in there. Again, it's free, all of their information, contact, whatever they prefer under their category. And if you are within multiple categories, let's say you are an IBCLC at a support group, but you also have at a hospital, not at a support group, at a hospital with a support group, but you also have your own private practice, you can list as many as you'd like. And then they get approved and they are live to families. The goal of our website is not for families to stay on Zip Milk for a long time. The goal is for them to gather resources and spend the time looking at those resources and finding the best fit for them. Something to note about the website is it had a shift over the last year where we now include an image. So something that I'm fairly passionate about and I continue to learn about is equity and access, and also families feeling, supported and can identify with the support that they have. And so an image can be helpful in that, but it is not required, and it could be a logo if you don't feel comfortable putting your own face up there, which is totally fine. So lots of great things there. I also work at a Celeron, which is where I am right now, and it's a DME that does support Maine and all over the United States. And I am the, I don't want to say I'm annoying here, but I do push boundaries. It's a DME, right? It's a durable medical equipment company offering breast pumps and supplies, but I'm constantly like, okay, I want to do this and it has no direct return on investment. There's no ROI, but I want to increase free support and education for families, for our staff. And I have this intense passion for the Hoot code now. It's just, it like boggles my mind. So I have already signed up for Ellie's research study and have so many more questions, and I love that. So yeah, Celeron, my update for them is we or for us, I guess, is that we just launched new support offerings to all of our families that receive their pumps through us. And so a free breastfeeding or a free pump support group, as well as an unbox your pump consult where it's actually what did you get, how to use it, care for it, clean it, all of that. A return to work consult, and then also a flange fit discussion. So always looking for more education and more information. And so, yeah, if you have anything to share on any of that, let me know. And then the last thing I'll say is I am really interested in doing research. And so if anybody has any info on the best way to like jump into research, and this is not a seller or a Mass Breastfeeding Coalition related, it's just me, which is why I put my personal email in the chat as well. I would love to hear from anybody that is doing research and has any advice for me. Thanks for
Thank
having
you,
me.
Brittany. Thanks for being here. It's a lot
Yeah.
a lot for us all to know, so I really appreciate it.
Yeah.
Good stuff. All right, Ariana.
Hi. Hi, Ariana here from Augusta WIC. I'm the breastfeeding peer counselor. I have a couple things. I've been really working on creating a fun International Breastfeeding Awareness Month for our local WIC participants. I'm planning on doing kind of a celebration week at each one of our branches, the Augusta, Waterville, and then Skowhegan. So I'll kind of piggyback off of somebody who said it earlier. If there is any supplies or anything cool that you're willing to share with us to give to our breastfeeding and celebrate our breastfeeding parents, I'd be happy to receive that, to hand them out. I have reached out to a couple places and I got these really cool pens that I thought I wanted to share with you guys. I got them through Fresh Baby, which WIC works through them a lot. I thought they're ordinary pens that have like little encouragement things on it, but really they are breast milk storage guides or tips. It's actually it's really cool. And then there's even another one that has like the breast milk facts and storage guidelines and all that jazz. So these are really cool.
Nice.
They definitely made our day when we figured out what they actually were about. Another thing that I am putting together, we have a meeting with the person next week. Pump Spotting is an app that WIC has partnered with to get a free subscription for a year for our breastfeeding pumping mothers. And off of that, they have a Breast Express tour, which is a lactation mobile bus that they are going to be touring around the United States. I've already contacted Jess, that's who we have a meeting with next week. And we're thinking about having them come to the Augusta Maine General at the end of July, kind of kick off the National Breastfeeding Month. So that's very exciting. That's coming up. And I would say the last thing, we just recently had a group staff meeting with Anna Rogers through the CDC. She gave us a presentation on the Pump Act and gave us a lot of resource material. She has given me her information and given me permission to share it on this, which I told her I was participating in this week. So if anyone, she's willing to go and travel and do training. She's also willing to partner up with anybody who would like her help to go to businesses to help them know the rules and know the laws for the mothers and the employees.
Perfect. Thank you.
That's it.
Yeah, if you can share her contact info. She's at the CDC or is she at the Department of Labor?
She is the community outreach resource planning through the CDC.
Okay. Cool. Thank you.
No, I apologize. DOL.
Okay, perfect.
I'm sorry.
Like, good timing. I was just thinking of who would be the person to contact at DOL for exactly that. So awesome.
Yeah, she's awesome. She came up to us and very willing to help. And I mentioned what the coalition has been doing with the toolkit and all that jazz, and she hadn't heard of it. So I figured that you two should connect.
Definitely will. Thank you.
Of course.
All right, we have Andrea and Abby. I think that's who is left. Thank you all, first of all, for hanging in there, and for Andrea and Abby for your patience as names start with the letter A.
Well, I was kicked off a while ago because our landlord came in to look at the electrical box, and he flicked some switches and my computer was gone. Yeah, so I'm Andrea Willett. I'm in Fort Kent, and I'm the site lead and a family visitor with Maine Families here. And all of the visitors in this county are certified CLCs. So if you don't know what Maine Families is, we support parents in their home through home visits, prenatal to age 3. Through the Parents as Teachers program, and we do a lot of different things with parents, but one of our focus areas is breastfeeding. So that's what we do, and I don't have a lot to add. We no longer have our hospital's no longer a birthing hospital, but that doesn't really change things a whole lot because we support families in their homes. So as long as they enroll and we're with them, we can support them.
Okay, awesome. Thank you, Andrea. Glad you're here from Fort Kent. All right, is Abby there?
Hi, I'm Abby Lacasse. I work for Maine Health's Community Health under the HEAL grant for Knox and Waldo County. I'm really just getting started in this work. I have only been here a month, so I'm just attending to become more familiar about the work everyone's doing and learn about some resources. So thank you for having me.
Thank you. All right, any last thoughts or questions before we officially end? I want to make sure everyone has their opportunity. All right, well, thank you so much for being here and for hanging in there 20 minutes past our meeting end time. Stay tuned for meeting minutes, and just stay connected to us. Let us know at any time if there's anything we can help you with, or we can connect you with someone else who we've met. All right, have a wonderful rest of your day, and thank you so much for being here.